From Brick Furniture Studio A at the Austin Area Chamber of Commerce, it's Chamber Chat.
Hi, I'm Elaine Hansen with the Austin Area Chamber of Commerce, and I'm joined today by Lee Aase from the Healthcare Clinic, and we're going to talk about health insurance today and options. In visiting with many of our small members, they are looking for ways to help their employees, stabilizing the workforce, and one of the big questions is benefits, and certainly insurance is healthcare insurance is one of those big things for many people. So that's why we're excited to visit with you today, Lee, about the Healthcare Clinic and the exciting new option that you have to provide. So
yeah, thanks, Elaine. We opened Healthcare Clinic in Austin in February of 2022 as a way to provide most of the day-to-day care people need. So with just one flat membership fee, they're able to get primary care, the preventive care, the annual physical, as well as then the timely care when they need it, when they get sick. For our new members who are enrolled in a Healthcare Clinic, the first day they have lab tests with us, the lab tests that are done for every new patient are worth more than $1,300 if you're buying it in the regular healthcare system. So just in the very first day of lab tests, they're saving more than the cost of their membership. Okay, that's kind of like having their rest of their primary care for the rest of the year free. Just being able to offer that 90% of the care for about 10% of the cost is really attractive too.
Yeah.
Well, one of the things we were missing was, so what if you need to go in the hospital? How do we handle the high end? And so we're excited that we've been able to come up with a new partnership, essentially with North Risk Partners, which is an insurance broker that provides a plan that recognizes the value of that day-to-day care that you get through a direct primary care clinic like Healthcare Clinic. The care is going to be provided in a more affordable way, a lower cost way, and something where the employees can do most of their care with us at Healthcare Clinic, and that's already included, and there's no copay for it. We've seen, with just one local employer, the ability to reduce their cost, have the employees keep the same deductibles that they had, and they include membership too with us. But we also include about 80 diagnostic blood tests at no extra charge, plus a couple of generic prescription medications, and then health coaching for people who are looking to deal with some of the underlying causes of disease.
A lot of times when you're thinking, I'm not sure what this is, should I go in or not? And I think, have I met my deductible? Where am I at? So then you don't go, and then it becomes a bigger issue.
Then it snowballs, and then it becomes a bigger thing. And so, the idea with it is that we want our members to never have to worry about, is there going to be a bill when they come to see us? And so because of that, instead of saying, okay, I got my $7,500 deductible, but I'm scared to go to the doctor because it's all going to be out of pocket, they know that they can go get the care at Healthcare Clinic without it being any additional cost at all.
What size a company will you work with? Is there a cap in terms of the number of employees that you would work with? Yeah,
there's no cap on the upper side, and but on the low end, 5 is sort of the minimum of employees.
I am going to be hospitalized. Is Mayo part of it? Obviously, we're right here, and we have Mayo Clinic right here in town. So
yeah, that was a non-negotiable thing for us, is we had to have Mayo be an in-network provider. And so Mayo and Olmsted and Alina are all part of the network. And so that counts against your regular deductible. But then they also have some interesting things where they'll say, if you pick one provider versus another, they may waive the deductible, because if you're choosing a lower cost provider, it's all up to the patient. They can do whatever they'd like to do. But if, say, you have a $5,000 deductible and they say, well, if you go to this higher cost one, you pay your $5,000 deductible. But if you go to this one, we'll waive your deductible. And for a lot of people, they'll say, okay, that sounds like a good plan. And the good news is then it's a win-win. There's an incentive for the employee. The employee can say, well, I'm saving the money, but then also the plan saves the money, which means the employer saves the money. If they do get sick, instead of having a copay to go to urgent care or whatever, they can talk to someone they already know, because they've had an onboarding appointment that's an hour long, and they're able to really get to know their provider. Because what that's going to mean is that a lot of the claims aren't going to go against the plan. The care is going to be provided in a more affordable way, a lower cost way.
If I was a small employer and I'm looking to find out more about this, how can I find out more information about this type of program?
Give us a call or stop by our office. So we're at 279-2345 here in Austin. I know we're planning a chamber event, coming up soon on September 18th as well.
Right.
Having an opportunity for people who want to hear a presentation about it and then be able to ask some questions. But we'd be glad to just talk with folks and explain, the range of options. So there's the membership only to the membership plus, an insurance package.
Well, thanks for coming in today, Lee. It's really great to hear about another great opportunity for healthcare and benefits for employers, because in this tight workforce, we're all looking for that advantage, a way to help it to attract and keep our workers. So thanks again for coming in, and we look forward to sharing more information about Healthcare Clinic.
Thanks, Elaine. Just delighted to be able to be with you today and share this good news.
Great. Thanks.